Well, today's a really exciting day for South Central, launching our vision for the next 10 years for the NHS, serving 4 million people across this region in a day hosted by Lord Darzi.
Well, I'm delighted to be here at the launch of the South Central Review. It's quite clear, looking at the South Central Review, the outputs are tremendous, they are ambitious.
This is a vision that's been built from the views of our frontline staff, from our clinicians who are passionate about their life's work improving services across this whole patch, and from the views of the patients we serve.
I very much hope it will meet the aspirations of your vision.
There are 5 million people out there that rely on us for our healthcare. Some of us live in the big cities, such as Leeds, where we are now, Hull, Sheffield, Bradford, etc. Others live in very, very rural areas. How do we make services flexible and accessible and appropriate for the sorts of people that we're serving?
In a way, the NHS is a misnomer. It's a national illness service. We respond when people are ill. So it is a massive cultural change. It is a challenge, but we've got to face up to it. We cannot simply go on with the current thinking of the illness service.
Change doesn't occur centrally at the Department of Health. Change always occurs out there, and that is what you've achieved through this report.
Taking part in something that really is a once-in-a-generation opportunity to really change the direction of the health service.
See our report and how that's translated into the vision is brilliant.
I think we're coming out with a document and with a vision that is much more patient-centred.
This is what we want to deliver. We want to make sure we provide a better
initial feedback in actually a very effective way. But I see the amount of energy, the enthusiasm since October, and you produced a document with tremendous ambition.
The NHS of the North East is in a good place, it seems to me, through this review, to take stock of where it is and set the scene for the next decade.
Our decisions will be guided by a clear commitment that there will be no avoidable deaths, injury or illness in our system. Now, they're very aspirational, but they are the uniform and driving force behind our vision.
It's led locally, it is clinically led, and it's also evidence-based. Thank you.
What's good is that everybody in the East Midlands has been involved, so patients, public, clinicians, managers. We have a very clear idea of where we're going, and that the patients have helped us to do that.
I think the challenge for us today is how we operationalise that now. What we must do is walk out of here and start making it happen.
We need to use the clinical evidence to know what's best. We need the right information.
You are the ambassadors for this vision, for clinical excellence, for user involvement, for leadership and engagement. You have to make this happen. This is a time for leadership and time to go back, because the culture and ambition of NHS organisation should be set by the doctors and nurses and the managers.
You have the vision, and I have no doubt we will transform the NHS based on the aspirations of all of us here on quality over the next decade.
I think it's a fantastic opportunity. There's been an awful lot of hard work going on over the past months, and it's a chance for us to showcase where we've got to so far.
I'm a fan of patient power. So I've been an NHS manager for years, but it's the patients in the end that should have the say.
It's about bringing the health economy together and seeing how we work together to deliver the best in patient care.
Our aspirations are ambitious. By 2018, people in Kent, Surrey and Sussex will be healthier, and when we, our friends or our families, need care, it will be consistently and reliably excellent.
I want a complete package of care.
Doctors and nurses should be at the heart of decisions about services.
I'm an individual, and so are my needs.
We're now going to take forward in the North West a new relationship with people that starts to talk to them more about how they can involve themselves in their own health, look after themselves better, perhaps have healthier lifestyles. One of the things that Aradazi has really brought to prominence since he came to join the government has been the importance of getting clinicians involved in making decisions in the health service. And in the North West we've got the Clinical Leaders Network, which puts us in a really good position to respond to Ara's challenge.
What's been really unique and fabulous about this experience is seeing 160 clinicians from across the North West, the public, patients, our partners in different organisations, the voluntary sector, getting together, really debating health and healthcare in the North West.
It's a really exciting day, I think, for the NHS in London and for anybody who cares about health services in London.
I think we are at a watershed, and it's up to us now to move it on and create the health and social care system that we ourselves would want to be cared for in.
The root of a lot of the challenges that moving on from today is to pick up the focus on what's right for people and make sure that that thinking trumps everything else. If you really want to change and focus on quality, which is all what your report is all about, you have to have that clinical leadership in making that change happen.
I want to improve the NHS because I'm a user. Everybody in this audience is a user of the NHS.
We need to move from a health service that's focused on reacting and treating, although we need to go on reacting and treating, we still have to have the best possible treatment services that we can, but to one that also focuses on predicting and preventing.
I think once we define what effective care is and we have clear outcomes to judge the quality of that care, it can be delivered absolutely anywhere.
We're getting the health service now in line with the generation that we are treating now, but more importantly, the generation of the future.